morning, everyone. I want to welcome you to our product expose. As you know, we have our expose every 8 p.m. Nigerian time. Okay, so as you know, my name is Dorcas Ajukugene. I'm a business and a wellness coach, and today I'm gonna, share with you some awesome stuff that I have prepared. But before we do that, I'd love to briefly talk to you about the platform. Longrich Bioscience is a great company all the way from Asia, over 35 years of age, and they're highly into research and development. I'm talking about a company that has 10 research and development centers around the world. Talking about research and development centers in the United States, in France, in Italy, in Switzerland, in China, in Japan. So we're talking about a company that has given its best at producing top-notch products for itself and for its partners. Now, Longrich has produced over 2,000 quality products. Wow, right? Now you might be wondering, oh my God, 2,000, that's a lot. We're not talking about 50, we're not talking about 100. We're talking about 2,000. And that, what does that tell you? Longrich is into, I've categorized the products available in our Nigerian market into 7 categories. We talk about male healthcare products, baby care products, female care products, energy healthcare products, personal care products, nutritional drinks, smoothies and teas. We have nutritional supplements. Now, all these products are produced or manufactured specially to give you a healthy and a beautiful lifestyle. So whatever you're looking for, you have it on this platform. Now, moving on today, we will be talking about urinary tract infections. Now, if you've been following us, we talked about the kidneys, the urinary tract, the urinary system, the kidneys, and today we're going to be talking about infections that can affect the urinary tract. Now, for a quick, run through of what the urinary system is. Urinary system is that system that handles, the cleanup, detoxification, purification, filtration, balancing of pH, the blood pH, and a whole lot of stuff. Now, we have special organs within the urinary system, but I just want to quickly show us something important about the urinary system. Now, if you look at this beautiful, enhanced view, you find the major blood vessels that supply the heart blood. These blood vessels are actually connected to the bean-shaped form of the kidney. Can you see it? Yeah, you can see it. The artery and the vein, the major one that supplies blood, and the blood contained within every human has to pass through the kidneys on several occasions in a day for filtration. So as you go about your affairs, when you take something in, there is an organ in there being checked consistently with toxic substances. Now, you can see the main vein to the heart carries cleaned blood. You can see it here, right? Now, the main artery from the heart brings blood with waste. You can see it here, right? So the one with waste is dropped. The one with purified blood, is released, right? So you have your left and your right kidney. Now, your kidneys form the your urinary system. Now it flows down. You can see there is a collection point from the kidney, okay? Yeah, that carries urine that has been collected as waste products from this point of filtration, okay? And that's the ureter, yeah, ureter, probably pronounced, okay? Coming down to this ball-like structure called the bladder. It's balloon-like because it has the ability to stretch itself when it's full and to, reduce itself, when it's empty. Now, there is a nerve signal to brain when that is full, and that's when you get that signal that you need to use the restroom, you need to go pee. There's a particular nerve here that tells the brain that the bladder is full. Now, when you come to this, there is another nerve that tells the bladder. So when you agree to go pee, the message is sent to your brain that, hey, okay, it's time to pee. Now, when you agree to pee, your brain will sense it, and this nerve here will tell, the moment you agree to pee, this nerve here will tell your bladder that it's time for it to open. So there's a kind of sphincter that will just, open up and release the urine, and you can do it in the toilet and all. And that is why, as an adult, you can hold your pee when circumstances are not favorable for you to go. We're not like children that will have to just go on their diapers, right? So we can, send a signal to the brain, hey, I'm not ready, you need to hold on. So you find yourself all jumpy and all when your bladder is full, because your brain is sending you reminders, hey, it's time to pee, it's time to pee, it's time to pee, it's time to pee, right? Now, we have a muscle that are closed. It's a muscle that has the responsibility of closing up the bladder and ensuring that the fresh pee that is coming in does not just go without your permission. So you have a role to play in ensuring that your urinary system functions well. And that role is you responding to the call that is sent to you when it's time. So when your bladder gets full and sends the signal to your brain, and you start feeling that pressure to go, it is your responsibility to go and pee. Now, we have some people that are professionals in holding their pees, right? I have good news for you professional. So follow, right? Let's go. Now, certain facts that I need to bring to your attention about the urinary system. Now, thousands of metabolic processes take place in your body every second, every minute, every hour. A lot is going on in your body. And due to these processes taking place in your body has to release waste products, right? Now, the job of the urinary system is to ensure that this waste product coming from several, cell metabolic actions, those things need to be cleansed, and those things need to be taken out from your body system through your kidneys, okay? Now, your kidney has the responsibility of regulating volume of water in your body system, the acidity of your blood, the salinity of your blood, the concentration of toxins and sugar and other things within your body, the chemical composition of your blood, that's the acidity or the alkalinity of it. It regulates your lymph, it regulates other body fluids within your body system. So regulation, or the act of carrying out homeostasis, is one of the responsibilities of your kidneys. Now, the way your urinary system is composed of a pair of kidneys. You saw that in the image I showed you earlier on. The bean-shaped, organ you saw that is called the kidney, and we have them in a pair. In other words, we have one at the left-hand side and one at the right-hand side, right? Now, we have we have a pair of kidneys. We also have a pair of the ureter, okay? The ureter is that pipe-looking stuff. So one is connected to the left, the other is connected to the right. Now you have one bladder, okay? Collection points at the bottom, okay, that helps to. Now the bladder is hollow and it's like a store. So I said earlier on that it has the responsibility of expanding to accommodate urine, and it has the responsibility of contracting when you are letting go of pee, when you agree to urine from your system. Now, urine is about 95% water and 5% waste products. And the waste product we're talking about are nitrogenous wastes, okay? Such as urea, ammonia, uric acid, and some others. We also have ions that are also excreted by the body, such as sodium, potassium, calcium, hydrogen. So excess of all these are taken out of your system in your urine, okay? So for the system, probability that this can actually take when there is, a deficiency or when there's an excess, right? So when that particular able to pay out is the result of something coming in excessive, something meeting up to the level it ought to meet, then a disorder could take place. So what is a urinary disorder? Urinary disorders, they include diseases, conditions that affect the vital organs that make up the urinary system, such as the kidneys, ureter, the bladder, the urethra, and their functions. Now, urinary tract disorders involve one or two of the kidneys. In other words, the left or the right kidney could actually have a challenge at different points in time. It could actually affect another aspect of the man's body, such as the prostate. Okay, the prostate gland could be affected, the testes could be affected, the epididymis could be affected, the reproductive organ could be affected as a result of that problem. And most of the time, the challenge could lead to persistent erection, scrotal pain, scrotal swelling as a result of inflammation, blood in semen, blood in urine, and a whole lot. So that's how it happens when it comes to men. Now, when it has to do with women, now, when it's very peculiar when we talk about women, because the urethra in women is very short. It's not as long as that of the man, okay? It's very short. In other words, the distance from the opening, the vaginal opening, okay, to the urethra is not very far. Now, for the woman, right, for menopausal women, due to the lack or the reduced level of estrogen due to menopause, the atmosphere of the reproductive organ is not the way it used to be when menstruation and other things take place. So the microbial flora that could be attacked by other invading microorganisms. Okay, so that's why they are very, very susceptible to urinary tract infections. Now, some urinary tract infections, some of them rarely cause symptoms, but others also cause symptoms too. And sometimes it could escalate to kidney failure. It could escalate to having tumors within the kidneys, kidney stones, blocking the flow of urine out of the system. Could also lead to low-grade kind of infections. So urinary tract infections should be attacked quickly to ensure that the challenge does not escalate from the state where it is, right? Now, some challenges could also lead to pain at the sides, swelling of the feet, urination of blood, or excess or frequent urination, gas in urine, foamy urine, and reduced, release of urine because of pain and because of obstruction in cases of those people that have kidney stones. Now, despite age-related changes, okay, the kidney has a way of managing itself even with age. Although as you age, as you get older, your kidneys may not function as excellently as they would function when you were younger, but you might just observe that probably you're not able to hold urine for long. You find out that when you're pressed, you can't stay for as long as 1 hour as you would do if you're in a place where you cannot just use the loo, okay? But as you get older, you find out that you might just withstand just 30 minutes pressure before you feel the urine coming out. So as time goes on, a lot of people could actually experience that, not really as a result of disease or anything. Now, the urethra does not change as much with age. So it's not really an age change. Some people could be older and still have their kidneys functioning excellently well. And that's how we tell people to maintain your kidneys. Don't be in your 30s and your kidney is as old as 70. okay? Because if your kidney is as old as 70, you begin to experience the challenges that 70-year-olds experience at the age of 30. And that's why it's important for you to go use the restroom when you feel pressed. When you feel you've taken a lot of water or you feel dehydrated, take enough water. Give your kidneys resources to work with, right? So that's that about that. Now, urine, it's important that we also consider, the function of urine. Aside the fact that we talk about its benefits and everything, it's important that we consider its role. Now, urine is a liquid byproduct, as I said earlier on, from the metabolism in human beings. Animals also pass urine out, right? They do also. So urine is a byproduct of excretion, from metabolic processes. Now, urine contains fluids, salt, waste products, and it's always sterile, okay? It's usually sterile and free of bacteria, viruses, and any other disease-causing organism, right? Now, there is a normal outlook for urine. Now, normal urine does not really have odor when it is in a dilute form. But if it's in a concentrated form, you will perceive more of the ammonia. You perceive more of the uric acid contained within. So if you use the restroom, as you're using the restroom, you start perceiving the smell of urine, you know that your urine is concentrated. Okay, if there isn't any other foul smell connected to it, it means your urine is concentrated. That's why the odor is stronger. So if you're not properly hydrated, it's a wake-up call for you to take water. Okay, now if you use the restroom and you don't perceive smell of that strong odor, that means you're properly hydrated and the ammonia level is not that high as it will be on the concentrated kind, right? Now, there are different changes that can happen to urine as a result of external factors that come inside. So for example, if you take medication, right? You take probably antimalarial or some other kind of medications. When your body excretes that medication, you can sometimes perceive it in your urine. Yes, you can. You find that when you're peeing, you're perceiving a particular type, or something like that. Something smelling, kind of thing. For people that take a lot of spice, you could actually perceive your spice when you pee because your kidney would have done a lot of detoxing and all that, and you could perceive, those kind of things from your pee, right? So it does not mean that there is problem, okay? It means that you took something and your kidney did a good job in clearing it out, right? Now, when you perceive sweet smell from your urine, it's an indication that the sugar content in your urine is very high. Okay? And if it's persistent, like if it's consistent, then it could be a sign of diabetes, okay? And it's important that you look into it, right? So the color and the clarity of urine could actually be an indicator that all is well or there's a problem. So it's important that don't just go to the restroom and just go and you're out of there. Take a look at what you just passed out of your system. Is it looking okay? Is it looking within the normal range? Can you tell where your body is at that particular time as a result of the concentration of your urine? Because you see, you taking note of all these things will help you take proper care of your kidneys, okay? Now, normal urine is yellow to amber. You can Google the amber color, you can Google yellow color so that you can compare it properly, right? So normal urine is yellow to amber in color and it looks clear. In other words, you're not expected to see funny structures inside. You're not expected to see thick substances. It's supposed to be clear. So if urine is nearly colorless, it could be a sign of excessive fluid intake. In other words, you are seriously hydrated. So if your urine is looking whitish, that means you've taken a lot of water and your body is just letting go of more water than the waste products, right? And in other cases, if you notice that you did not take enough water and your urine is too clear, then it could be a sign of diabetes. So you should take note of that, right? Now, very dark urine may be an indicator that your body is dehydrated. In other words, you don't have enough water in your body system. So your kidneys don't have enough to work with, right? And in some cases, it could also look that way if you take certain kind of medications. For example, if you take a lot of blood medicine, yeah, especially those ones that are, you could show when you ingest certain substances that, leave high coloration, it could affect your urine also. Now, if the urine has a reddish thing about it, it could be a sign of blood in your urine, okay? And it could be as a result of urinary tract infection. It could be as a result of a kidney stone that's actually causing havoc in your kidneys, okay? Or it could be as a result of cancer, okay? Now, when there's blood in urine, in some cases, the urine could appear pinkish, it could appear reddish, it could appear in a brownish form, okay, depending on the amount of blood. Now, when it's, in some other case, it could be as a result of the amount of acidity. Probably your urine is highly acidic at that point, and that's why it's looking that way. So if your urine is cloudy instead of clear, it could be as a result of your white blood cells, showcasing themselves in your urine as a result of an infection that your body is fighting. Because most of the time, most times, when white blood cells are highly concentrated at a particular point, it tells us that our body is doing something there as a result of infection. Now, moving forward, this is a urine color chart that can help our minds, that can help us. For those people that are not aware that they should take note of the coloration of their urine, this is a urine color chart that can help you understand what's happening from looking at your urine, okay? Now, when your urine is clear, which is the first bottle we have here, when it's clear, you can see that it's almost transparent, right? This is very good. Your body is properly hydrated. In other words, the water level in your body is excellent. And that is why your body has enough to let go of, right? Now, if it's light yellow, it's also good because water is there, urea is there, ammonia and uric acid and the rest of them. Okay, sorry, yeah, all contained there. They're fine, doing well there, right? Now, when it's yellow, it's fair. If it's yellow, it's fair, right? But from this particular point, it begins to give you the warning sign that, hey, it's time to take more water, right? I'm getting concentrated when you get to yellow, which is fair. Now, when you get to dark yellow, it tells you that you're at the point of light dehydration. In other words, you are dehydrated, you need to get hydrated, you need to take water. Water is not enough. So your kidney is recycling water within, and it's waiting for you to act to supply it with more water. Now, when it's amber, it's indicating that you are dehydrated. Now, amber, you can see amber color here. You can compare to your traffic lights, right? Green, yellow, and amber, right? So it tells you that you're dehydrated. You must take water now. So at least, and when you take water, when you get to this point and you take water, check out for your next pee. You'll notice that your next pee will be around this light dehydrated state. If you're taking more water, you come to this point. If you're not taking good amounts, you should find yourself at this good point or even very good, right? Now, when your pee is brown or red, it tells you that you are very dehydrated or you are severely dehydrated and your kidneys don't have enough water to work with so that their filtration, work can go on excellently well. Now, when you hold urine in that way for too long, you deprive your kidneys of proper functioning. And over time, it could lead to certain challenges. Don't forget that the urine helps to clear out toxins. So when you allow toxic buildup on the inside, it could lead to challenges. Now, one of the challenges that an individual can experience is urinary tract infection. Urinary tract infection is an infection of the urinary system, okay? So this involves all the components of the urinary system. your kidneys, it affects your kidneys, your ureter, your urethra, your bladder. It affects all these things. Now, if the challenge is targeted at your bladder, if your bladder is the one having, being inflamed, if your bladder is the one having pains and all that, the condition is said to be cystitis. Okay, it's known as cystitis. Now, if it's your kidney, okay, it's known as pyelonephritis. If it is your urethra, it's known as urethritis. Okay, so there's this titis thing going on, right? But if it affects any of these components, it's said to be urinary tract infection. Now, as we know, urine is a byproduct of this. If urine is not coming out of your body the way it ought to, then there is a problem. Okay, and most of the time, the problems involve infection and inflammation of the urinary tract. Infection or inflammation of the kidney, infection or inflammation of the bladder, infection or inflammation of the urethra, infection of the urethra. Okay, so all this inflammation and infection is what we're talking about right now with respect to urinary tract infection. Now, UTI, that's a short form of urinary tract infection, is a term for an infection that takes place throughout the urinary tract. That's what I just told you, right? So more than 90% of bladder infections are caused by a microorganism known as E. coli, okay? A bacterium that is normally found in the intestines. Now, when you find a microorganism that ought to be in the intestine, staying in the urinary tract infection, you know that invasion has taken place, because our body system has been fashioned in such a way that we have normal microflora. In other words, there are certain microorganisms that are supposed to be found in the face region. There are normal microorganisms that ought to be found in the vagina. There are normal microorganisms that ought to be found in the bladder. In the urinary system. We have the normal one that ought to be found in the small intestine, the large intestine and all that. Now, when a microorganism that ought to be on the skin finds its way to the bladder, what does that tell you? There's invasion. Something is not right. And if that microorganism comes in and your immune system is not able to fight it, it goes into that particular place and begins to attack the normal flora of that particular place. Now, if it's the vagina for a woman, if you have vagina-related infection. If it's the colon, another kind of infection. If it's, so if it's on the skin, the same thing. So it's important that we keep our microflora in their rightful place. It's important. Now, in the case of urinary tract infection, when a microorganism that ought to be in the intestine travels and finds its way in your bladder, it will begin to cause trouble. Now, imagine a person that does not believe in using the restroom quickly. Probably if that thing was still at the passage point of the urethra, it will just be easy for you to let go of pee from your bladder and palm, it will wash it out. But if you hold it in there, you give the microorganism opportunity to keep traveling up. And the more it travels, the more it causes trouble. Now, when it gets to the kidney, it causes kidney problems that could lead to kidney failure. Okay, so let's move on. Now, antibiotics are the kind of medicine that we utilize in killing this kind of bacteria that causes infection in the urinary tract. Now, urinary tract infection. Now, if you look at everything I just said, I just want to show you a pictorial view of it. So you can see your kidney, your urethra, your bladder, your urethra here, right? Now, this is an opening here. Now look down, this is how it ought to be on a normal day. When there is an invasion, this is how the bacteria will come in. Bacteria will travel up the urethra, get to the bladder, travel through the urethra here, then get to the kidney and invade the kidney and begin to cause havoc there. Can you see it? So, and most of the time, the bacteria responsible for this invasion is usually from the skin or from the rectum. Now, I know someone's wondering, how does it happen, right? Okay, I'm going to tell you. But first of all, let's talk about the microorganisms responsible for that. Now, normally urine moves through the urinary system without any form of contamination, okay? But when bacteria, get into the urinary system from outside, they cause infections like they cause infections and inflammation. Now, a UTI occurs when bacteria from another source, gets in there. Now, the most common bacteria found to cause this kind of infection, known as urinary tract infection, is a microorganism known as Escherichia coli, or short form E. coli. Now, other bacteria also cause this, right? But E. coli is the major culprit in 90% of the urinary tract infections that are diagnosed. Okay, now E. coli normally lives harmlessly in the human intestinal tract, but it can cause serious trouble if it gets into the wrong place, which is the urinary tract. So when it's in the intestine, it's fine. It's okay. It's doing its job excellently well. But when it travels, it causes problem. Now, UTIs are caused by both gram-negative and gram-positive bacteria. Okay, and sometimes some fungi too. If a fungi that ought not to be in the urinary tract gets there, it could also cause problems. Now, we have some agents that have been implicated in urinary tract infection, of which number one is what? E. coli. So if there's anything you shouldn't forget today, E. coli is a major culprit when it comes to urinary tract infections, right? Now, if we're to look at the next in prevalence, or in the next in its toughness, is Klebsiella pneumoniae. Klebsiella pneumoniae is another microorganism that can produce urinary tract infections. Another is Staphylococcus enterococcus fecalis. Staphylococcus enterococcus fecalis. That's another virulent type 2 that can cause trouble. We also have the group B streptococcus that can cause issues. We have Procteus mirabilis. We have Pseudomonas aeruginosa. We have Saprophyticus. We have Saprophyticus. We have Staphylococcus aureus. And we also have Candida species that can invade the urinary tract. Now, in a more complicated form or case, we have Klebsiella working. We have Staphylococcus aureus. Now, Staphylococcus aureus is a microorganism found on the skin. Very harmless. It does an excellent job in ensuring that your skin is protected externally. But you see, when Staphylococcus travels and enters into the urinary tract, Staphylococcus can be very dangerous. It can cause a lot of trouble and discomfort to male, to female, and all that. And that's why we tell people that Staphylococcus is not an STD or an STI. It's just a normal microflora microorganism that just found its way into the wrong location as a result of a person's carelessness, okay, or indiligent. I don't know how to use that. I don't know the term to use, but I'm going to show you why I'm saying it's the responsibility. Now, we have risk factors, but I'm going to be emphasizing more on the risk factors for women than men, because women are more susceptible to urinary tract infections than men because of their reproductive organ. Now, if you're a woman in the house, I need you to pay serious attention to this. Now, before I come down to talking about the specific risk factors or the specific things that make us prone to this challenge, I want us to look at this diagram here. Now, this is the entrance to the uterus, right? Now, don't forget that every woman has two openings, right? You have the anal opening, that's the opening for the anus. You can see where my cursor, please look at the cursor very well so that you can understand this. Now, let's start from this point. Now, the three pictures you're seeing here are the same, but I'm going to explain to you what's happening. Now, this particular one that I'm circling with my cursor, you can see my cursor here, right? Is a normal, regular one without any invasion, right? So this is the anal opening, right? While this is the vaginal opening here. Okay? And don't forget that one leads to the urethra, the other leads to the uterus. Okay? Now, this particular this particular opening leads to where? The bladder and the urethra. The urethra and the bladder, right? Now, if you look at this particular point, this place is clean, it's free of microbial invasion. If you look at the anus or the rectum point, you can see microorganisms here in small purple dots, because that's their normal habitat. That is where they are supposed to be. They help in breaking down, the final waste and let it out. That is their place of assignment. Now, when a woman uses the restroom, when she's done doing number 2, we call that number 2 when you go for bowel movement, right? When you do number 2 and it's time for you to clean, all right? If you clean from back to front, now this is back, right? This is the front, okay? The vagina area, this is the back, the anus area. Now, when you clean with your tissue paper, if you clean from back to front, as in back to front movement, from your back to the front, using your tissue paper and all that, you are carrying microorganisms from the back here, and you are introducing them by yourself to this particular point. Now, let's go to picture 2. But if you're that kind of person that will not take enough water, you will not have any need to use the restroom, the microorganism, now look at picture 3. As you've done your back to front cleaning and all that, or you don't even clean properly. If you don't clean properly, those microorganisms will come out of this, the anal point, and sit here. Now, when they sit here, they begin to travel, like ants. They will travel from the back by themselves. Can you see the uterus? Some of them will go to the uterus opening here, which is the womb area, if you're not careful. Now, some of them will still travel to the blood, to the urethra, to the bladder here, if you don't clean properly. So if you find out that you're always having infection, you need to check your hygiene. You need to check the way you clean yourself when you're done using the restroom, when you're doing number 2, because these are the easy ways that these microorganisms are introduced. Now, if you don't pee quickly to flush them out, they will continue to travel. Now, when their numbers have increased, your peeing will not be enough to clear them out. You now need antibiotics to fight them, because at this particular point, it has overpowered all the microorganisms, the normal microflora there, and they start multiplying and killing and lysing a lot of things there. And don't forget that E. coli can be very, very notorious for causing injuries, internal injuries. And that's why bleeding comes into play. And that's why you find out that a person is peeing blood after some time, probably if the person did not take it seriously. So the female anatomy is one of the major roles, because the urethra is very short. For men, it is longer, but for women, the distance is very short. That's why the microorganisms can travel. Number 2, sexual activity. Now, for women that have multiple partners, when you change partners anyhow, you stand a very strong chance of ending up with, a UTI, because imagine you have a sexual partner that has a UTI already. Person could easily introduce it to you, and bam, you received it, and you begin to battle that particular challenge. Now, we have certain types of birth control that can also, open you up to this kind of challenge. Now, for people that use diaphragms, like a cup, to cover their cervix and to prevent pregnancy, it could actually lead to, because you have to apply the spermicidal cream, you have to place it there. After some time, it could actually lead to that challenge if probably it was infected before you inserted, if you didn't carry out proper hygiene before inserting and all that, you could introduce microorganisms there by yourself, okay, and it could lead to challenges. Now, women that are menopausal, because of declining estrogen, okay, the urinary tract might become vulnerable to infection. Then a suppressed immune system, if your immune system is down and weak, a little shaking here and there, probably use the wrong toilet, or the toilet that's, an infected person has used and has released enough microorganisms there, you sat on it without cleaning and all that, you could just pack it up and introduce into your system. And your body's immune system, because it's weak, may not be able to fight that infection easily. Now, a lot of people get away with this kind of challenges when their immune system is strong, because when the immune system is strong, the immune system will fight all those things without you knowing. But when your immune system is weak, those microorganisms will multiply nicely without you even, without waiting for you to, have a say concerning it. So we have general risk factors. Aside the ones I just mentioned for women, we have other risk factors that can open you up to this kind of challenge. So one of them is birth defects. We have some people that have birth defects that, with their urethra, okay? The way the urethra is formed does not really give them enough covering, so they easily get infected. Now, for people that use catheter tubes to drain their bladder, probably people that have urinary issues, they're not able to urinate on their own, and they have to carry place a catheter to help drain out urine from the bladder. They also have, the likelihood of ending up with, urinary tract infection, because this catheter could be infected if it's not properly handled before it is inserted. So it could cause that. Now, when you come in contact with chemical irritants, it will also lead to urinary tract infections. In most cases, we tell people not to use soap or harsh kind of washing stuff on their vagina, especially for women. But some people feel it's their responsibility to clean the vagina and its environment. So they get harsh chemicals that end up irritating that place and killing the normal microflora there. So when that microflora ought to stand as gatekeepers and protectors of that, when you kill them, microorganisms can easily, like E. coli, can easily march into your urinary tract and begin to have booger time, right? You need to booger, in there, right? And they call their brothers and sisters to come, and they start marching like ants to cause havoc. So as a woman, please do not use chemical substances that are harsh on especially the vagina opening or within your vagina, because your vagina has a self-cleansing action that it carries out in order to keep it clean. It's not your job to keep it clean. Your job is just to take care of the outer parts by doing rinsing and cleaning with water or mild, very mild stuff. Okay? Now, when you take cigarettes, when you smoke cigarettes, it makes you vulnerable. When you have diabetes, it makes you vulnerable because it will increase the growth of certain type of microorganisms that, can lead to urinary tract infections. When you have genital piercings, people that love to put rings and all those things in their genitals, as those actions are taking place with those equipment, you could get infected. Intake, you take enough water, your body will not be able to excrete the toxins out of your body system, and you begin to have what? Toxin buildup, right? Personal history or family history of urinary tract disorders. If your family is consistently having urinary tract issues, probably you must have collected it as a genetic, property or something. So then pregnancy and delivery. We find out that a lot of pregnant women end up with UTI because during pregnancy, don't forget that the uterus, like sits on the bladder. So most of the time, that pressure, is always there. And due to the fact that the woman is pregnant, her immune system is a little bit low. So it could also, open the door for that. Then during delivery, if proper hygiene is not taken, when the woman is giving birth and all those checking for how many meters dilation and all those things, all those putting of hands and all that, if those things are not properly checked, the woman could actually end up with an infection. So that is also that. Now, sexual contact, I've talked about that. When you have high risk sexual behavior, people that have anal sex and the rest of them, you could be introducing the wrong thing, especially for the men that don't use protection for anal sex. You could just introduce the wrong thing into your genitals and you end up having, that. So other systemic diseases as a result of your immune system, surgery, trauma, unsafe practices, the use of deodorants, tampons, and that. If you use tampons, please, you are to change your tampons at least within, it shouldn't be more than 4 hours when you use your tampons. So to prevent toxic shock syndrome, okay? Toxic shock is another killer, okay? So aside toxic shock syndrome, It also helps to prevent breeding of microorganisms in your vagina that can also affect your urinary tract, okay? Using of spermicides. Spermicides that prevent pregnancy can also serve as irritants. Now, we have several symptoms that can tell you that it's a urinary tract infection that you're coming down with. So when you feel pain at the side, okay? When you feel side pains, it's an indicator. When you feel abdominal pains or pains within your pelvic area, when you feel pressure in your lower pelvis towards your bladder area, you know that when you find out that you're urinating frequently, or you have this urgent need to urinate within a short period of time, you know that there is a problem. Then when there's inconsistency, when you find out that it's like the urine is leaking, you are pressed, but instead of it to just come out, it's like it's leaking, it's dripping, you know, there's a problem there. When you have painful urination and blood is found within your urine, it's a wake-up call. Something is wrong within your urinary tract, okay? Now, when you need to urinate at night too frequently, it's, you know, a wake-up call. Now, when you find out that your urine has an abnormal color, it's looking cloudy, and it has a foul smell as a result of the microbial activity, then it's time for you to take action. You could be coming down with a UTI, okay? Now, when UTI is attacked at an early stage, it is very, very easy to manage, okay? But if it's not attacked early, it could escalate into other things. Now, other symptoms that could be associated to urinary tract infection could include pain during sex, having the penis, you know, when you have pain, when you try to ejaculate or when you try to ease yourself, or on a normal day, you just feel pain there, right? When you have lower back pain or side pain, when you're always tired, when you're having fever and chills, you're vomiting, and you're having a form of confusion, or you're not understanding what's happening in your environment. If you have more than 70% of everything I'm talking about here, then it's time for you to run and get a diagnosis from the hospital. It's important that you go get checked. Now, we have several types of ways that your doctor can actually check to see if you have urinary tract infections. One of them is called urinalysis. Urinalysis is a test where you're asked to bring in a urine sample, okay? You're asked to pee into a cup. You take the cup into the laboratory, and they begin to examine the cup. Now, they will check for red blood cells, they check for white blood cells, they check for bacteria. And if they find out that that sample has this in their numbers, then, you know, a report will be given. Then we also have urinalysis strips that can be utilized, that can also take into cognizance the presence of all these things, a reading. Now, that reading will also help your doctor to understand, that you could be coming down with urinary tract infection. Now, we also have what we call urine culture. Now, urine culture is when that you're given a cup, you're asked to pee into a cup, and that urine is taken to the laboratory and it is cultured on an agar plate, right? Now, your urine is kept into food for microorganisms, right? There will be food in a plate. Your urine will be kept on that plate, right? Then it will be kept in an incubator where the microorganism can grow very well at its own pace for a couple of days, like 3 to 6 days, right? Now, whatever microorganism grows in that agar plate will be checked. The characteristics will be checked by the laboratory scientists, and they will now tell to see the type of bacteria. So if it's E. coli, there's several signs that E. coli will give when it's growing on an agar plate. If it is Klebsiella, if it is Pseudomonas aeruginosa, whatever it is, there are certain signs that they will give on the agar plate where they grow. And that will help the scientists to find out the particular microorganism that is causing the urinary tract infection. Now, some people will have UTIs and just go and buy over-the-counter medication. It's wrong, because it's important that you have as in the technical know-how of what's going on. And that can only come when this microorganism is checked. Now, there's also something we do in the laboratory, okay? When we've cultured and we've found out by particular microorganism, we would take an antibiotic strip to check for the particular antibiotics that can kill that microorganism. Now, when we place it, we'll incubate it. Now, if that any antibiotics that can successfully kill that microorganism we've cultured in the laboratory. That is what we recommend to you that's what we give your doctor to recommend to you when you come for your checkup. So when your test result comes out, we'll minute it down there that, hey, when we cultured this urine, we found out that so and so microorganism was found, and this is the antibiotics that killed it. So your doctor will recommend, we could give them 2 to 3 types of antibiotics to combine. So say, okay, this one works, this one works. So it's now left to your doctor to utilize that information in ensuring you get better. Now, imagine if you don't go to the hospital and you just go and buy over-the-counter medication. Do you know what you're going to do? You're going to feed that microorganism with antibiotics that might not be the one that can kill it. So when it comes, the microorganism say, do odeshi, and when it does odeshi, what happens? You will not feel better. Instead, it will now grow stronger. You will buy another one again. It will do odeshi. Before you know it, you're carrying a UTI for 6 months. And before you know it, it begins to break down your urinary tract, your urinary system. Before you know, your bladder becomes inflamed. You are no more okay. You're sick. And the moment it gets to your kidney, problem comes, because the moment microbial infiltration takes place in your kidney will begin to fail. Your kidney fails when it's not able to carry out its responsibilities. And simple carelessness can lead to that. So urine culture can also take place. Now, if the infection is more than, what all these things are saying, they've tried all the culture and everything, you could be asked to go for an ultrasound where they can now start checking your internal. Probably the damage the microorganisms have done to your organ is so much. Now they're trying to arrest it. So they need to now know how your organs are. If you need to go for surgery, you now have to start thinking of surgery. We also have, in some cases, a cytoscope, okay, could be kept inside your urinary tract too, with a camera to check to see the amount of damage that has been done. A CT scan too, which is higher than your normal X-ray, could be done to find out what's going on within. So treatment and caution. Antibiotics are the major stuff we use to kill bacteria and to fight infections when it comes to urinary tract infections, okay? So as I explained earlier on, your healthcare provider will pick the drug based on what has been, found in the laboratory for you to, handle that challenge so that you can get better. Now, it's very earlier on that you follow your doctor's prescription, because antibiotic resistance can take place easily. And if you're not able to, stay with your medication, you could just make that microorganism more powerful than it ought to be. And you find out that it's not going anywhere. Okay. Now, people, when they give them medication, no matter when they start feeling better, they say, "This is no more paining me now, eating blood again." So what's there? What's that? I'm okay, Joe. You abandon. If they give it whatever dose you were giving, start and finish it, complete it, please, so that you don't kill 50% of the microorganism and leave 50% behind, because that's what happens. When you start feeling better, probably it's just 50% that has been taken out from your system. The remaining 50%, you are supposed to allow the drug take care of those ones. But because you felt you know better than the medical practitioner, you decide to stop. Guess what? That 50 will begin to multiply again, and they'll become 100, and you're back to square one. And that is why it's important for you to start and finish your medication, no matter how good you feel when taking the treatment. Now, your body can get used to a particular type of antibiotics, and the microorganism will also become resistant to it. Okay, and that's what we call antibiotic resistant infection. So you find out that you're using medications, it's not doing anything. That's because you have created a scenario where anything you are bringing is like normal. So the microorganism is not responding, your immune system is not able to use it for anything, so you're just there. And that's very bad, okay? So how do we prevent this kind of challenge? How do we prevent urinary tract infection? Very simple. Practice good hygiene. I think I need to increase my volume. Practice good hygiene. For the guys, practice good hygiene. Don't wear one boxer for 1 week or 1 month, please. Now, I'm not here to trash the guys, but there's this stereotyped information in the female kingdom that men love to repeat their boxers unnecessarily. Now, let me give you a scenario. Imagine Mr. X going to the toilet. Now, he has done his job. He did a quick wash. He didn't even check if it was thorough. Just wash, or just splash the water on his bum if it was in water, or use the tissue, Then probably there was still a little bit at the entrance. He puts on his boxers. He still has a little bit of fecal waste at the bottom. He sits on his boxers. What happens? Now, that fecal waste will stick to the bottom of his boxers. Now, Mr. X, because he knows how to use his boxers for 1 week, we're going to carry that fecal waste. Today, if he sits this way, that space, that point where the fecal waste will shift. And before you need to gradually going to move like that. And the microbial invasion will begin. If it's for a woman, you don't wash your panties so easily. The same thing can happen to you. And don't forget, for the women, it's easier. Or when you're wiping, you wipe from back to front and not, not front to back. That could be a problem. That could be a problem. There was something I learned in the North. It's called in the North. The Northerners have a way of using water to wash. They feel it's cleaner to wash that way. I fought it for some time, but as a border, when your tissue gets finished, you have to learn to do it the hard way. So, but you see, I learned something extra. After using the tissue sometimes, if you can get wipes, baby wipes, use baby wipes. That is even better because it has a little bit of liquid that can help to clear it out totally. And don't be stingy with the wipes. You can use like 4 or 5. Ensure you have thorough cleanup before you leave the restroom, because your urinary tract is counting on you to ensure that E. coli does not travel from second base to first base. Okay? Yeah. That's sincerely. Okay? Or if you cannot afford wipes, then if you don't using your tissue, you can also get water. Use water to wash. Wash your anus properly. Ensure that you've done a good job. Water is free. Use it well. Okay? Wash, clean up properly. Teach your children to also learn how to clean up properly so they don't grow up to be adults that cannot take care of themselves. Okay? Because E. coli can move from the rectum into the body. Okay? Yeah. So drink plenty of fluids. Take water. Water helps to clear out bacteria from your urinary tract. And the recommended number is from 6 to 8 glasses of water per day. Take water. I have a reminder on my phone that tells me to take water. For ladies that have your menstrual app, your period calendar, there is a part that reminds you of taking water. Drink water, it helps. For ladies, when you're on your periods, to clean up well so that you don't breed the wrong microorganisms. Okay? Now, don't hold urine for too long, no matter what. Try it as much as possible to relieve yourself of the urine, because the more you hold it in there, the more you risk having an infection. Okay, so the moment your brain tells you to pee, look for options that can, help you within a space of 10, 15, 20 minutes. You let it go. And as you are letting go of taking fluids, replace. That's what I do. Every time I ease myself, it's like a wake-up call. You need to take more water. So every time I ease myself, as I'm going back to wherever I was, I pick my bottled water and I drink, or I pick my pie cup and I drink. Okay, so change your attitude when it comes to urinating. Nobody's going to give you Nobel Prize for holding urine for 10 hours or 5 hours. Okay, yeah. So urinate before and after sexual intercourse. For the married people in the house and for people that have sexual partners, please ensure you don't carry a full bladder left and right. Urinate, clear that passage by urinating. When you're done, after intercourse, you don't know what has been introduced into your body at that time. You don't know if your partner already has UTI that might just be coming close. You don't know the hygiene level of your partner, okay? And that's why it's good for you to tell your partner, have your bath. It's good to demand, in as much as the bubbles and the sparks are going in the air. Say, babe, have you had your bath? Could you go have your bath? Wash up nicely. I'll be waiting. Nice, as in very polite. Don't say it rudely. Don't say, oh, guy, you don't start again. No, I know so you never bath. No. Don't be harsh. Be nice. Be polite. Please, could you have your bath? Nicely. At that particular time, you know that person is going to wash up the genitals, wash up everywhere before coming to bed. So you are sure, do play your own part. Don't forget that wellness has to do with your responsibility to ensuring that all the factors around you promote good health. Now, change your birth control. For people that use diaphragm, change your birth control. You can use other methods, right? Take your injection, take pills, do whatever for birth control. Now, use a water-based lubricant for people that experience vaginal dryness and you need to use a lubricant, a lube. Ensure that you're using water-based. Don't use other strong chemical-based stuff that could irritate your vagina and cause infections. So do that. Now, change your clothing. Men, change your boxers. Women, wash your underwear. For a woman, you're not supposed to use some, at least in a day, you're supposed to use 2 types of panties, at least. For me, every time I shower, I change my underwear. If I shower 5 times a day, I change my underwear. It's just something that you should mentally imbibe, okay? You cannot be too clean. As in, you can't be too clean. So in as much as you've done everything, change your underwear, okay? It helps so that you don't introduce microorganisms back. Then don't put on nylon-y kind of panties. Don't put on all those kind of panties that will not allow air, okay? Put on cotton underwear. It will enable air to get there because microorganisms grow when there is no air well there. And when, there's trapped stuff. Then for ladies, try to clean up after using, the restroom if you can, so that you don't have that moist environment that can fester microbial growth. Okay. So, and for the men, change your boxers. It helps. After you pee, wash your hands, right? Wash your hands. Don't introduce into your food, right? So then please, take supplements. Supplements also help to, boost your immune system and to keep your immune system top notch. Now, when I talk about using supplements, I'm not going to tell you to go get another person's supplements. I'm going to tell you to use Longrich supplements, okay? So use Longrich supplements. Take Longrich green tea. Longrich green tea has an excellent way of clearing out, of supporting your kidneys in its detoxification work. It can help to detoxify your body system. So if you look at it here, it's a fantastic detoxifier. So when you take it, it will help to do that, right? Now, it helps to soothe the digestive and respiratory system, okay? So for people that have poor digestive system, that are always constipated and all, that could lead to prolonged stay in the toilet, pains, bleeding, and all those things that could create openings for microbial invasion, use our green tea. It can really help you. It can really help. Now, for urinary disorder, you can see it here, right? It increases the production of urine, cures inflammatory and burning feeling during urination, and inhibits infection in kidney and the urine system. Because water is one of the major things. When you drink green tea is in water form. It will pass through your kidney. It will pass through your urethra. It will pass through your bladder. It will pass through your urethra. Okay, so take green tea. Green tea is excellent. It can do excellent stuff for you. See, it also has anti-carcinogenic properties. So tumors, kidney stones, and all those things would not, affect you when you patronize a green tea. Kidney disorder, it washes away toxin in the kidney. You can see it here, right? Yeah, it does that for you. And it also it improves blood circulation. Don't forget that the kidney loves its blood flow. So it helps to promote blood circulation and helps to relieve your kidneys of excessive work. Oh my God, time is fast spent. Oops, I got carried away. Guys, so sorry about that. I'm going to rush. Now, blood fat tea is also an excellent product that you can take for proper urinary tract care, okay? It helps to improve blood circulation. It is a detoxifier. You can see it here. This attribute excellent, improves blood excellent, is good for you. It also helps to take care of other challenges, cholesterol challenges, sugar challenges, and all that because of its detoxification. Drink water from your pie cup. Your pie cup has the ability to revive damaged cells. So in case of inflammation or challenges or trauma that's affected your urinary system tract, you can fix it using taking water from the pie cup. Don't forget that the water from the pie cup has increased energy. It facilitates digestion, facilitates proper blood circulation. It helps to also reduce the toxin within the blood. So that acidity that your kidneys have to fight to regulate. When you take water from the pie cup, it helps to reduce acidity because it has alkaline potentials. It also helps to build your immune system. It boosts your immune system, and it helps to clear out, toxins. For people that get drunk easily, people that take alcohol, it helps to take out that the intoxication. Okay, and it helps to balance pH. Because of time, I have to run. Now, we also have our Longrich berry oil. Don't forget, our Longrich berry oil is excellent in taking care of the organs of your body. It helps to take out pathogenic wind. It helps to provide micronutrients that are needed for metabolic actions that take place within your body. It helps to provide you omega-3, 6, 7, and 9. It helps to also kill pathogenic wind. So if there's any pathogenic wind that is just invading your urinary tract, it can help to clear it out. Then we have our Cordyceps militaris, that is a natural antibiotic. Now, don't forget that we said gram-positive and gram-negative microorganisms are responsible for this invasion. Now, you have your natural antibiotics here that can help you combat them. So when we compare our Cordyceps militaris to your normal antibiotics that you take, now this is something you should not forget. Your normal antibiotics that you buy from the store are chemical-based. They need to be excreted quickly from your system, and they come in to attack the microorganism directly. But when you take Cordyceps militaris comes to support your immune system by boosting your immune system, boosting your white blood cells, boosting everything that needs to be boosted to fight the infection. So no matter how resistant the microorganism, as it's forming odeshi for the other medication, this one, your body is saying, don't worry, I have enough energy to fight you 24/7. Can you see it? When you take Cordyceps militaris, you're empowering your immune system to fight that infection at all times. But when you take a medication, that medication has a time span it will stay in your body, and it has to leave your body system till the next dose for a period. And you can't take antibiotics forever. There's always a short timeline for antibiotics. But with Cordyceps militaris, you're taking a dietary supplement that can help your immune system stay strong and keep fighting this challenge until it clears out. If that's the only thing you learned today, I think that's top notch already. Okay? It inhibits the spread of what? Pathogenic organisms like E. coli. It revives dead cells. So if the cells of your kidney has been destroyed, you can count on Cordyceps in helping to revive them. It regulates your blood pressure, your blood sugar, and other things. It takes care of your internal environment. Don't forget that Cordyceps militaris has adaptogenic benefits. Any problem you're having inside your system, it begins to regulate, because it's working with your immune system. And your immune system is the janitor in there that is handling problems up and down. Now imagine you giving extra hands to your immune system. I mean, nothing can go wrong. Now, for every product you buy from the Longrich Bioscience platform, you get what we call PVs, okay? Every product comes with PVs, and PV represent product value or point value that enables you to earn money on our platform. Now, we have several entry levels that you can come in with as a partner. Now, all Longrich is saying is, join us, buy our products, use our products, get testimonies from our products, share your testimonies with other people so that they can enjoy those benefits of living a beautiful and a healthy lifestyle. Now, these people can, every time they buy something from us, we will pay you. If you can get us heavy traffic, you get heavy amount of monies in your bank account that can cure urinary tract infections. Okay, so you can come in through different entry levels. You can come in at the starter level, the Q Silver level, Silver Gold, Platinum, or the VIP level. So wherever you are, at whatever level you're in, you can come on board. You can come on board as low as 14,000 and with as high as 1.2 million naira. So The rich is accepted, the poor is accepted. And at the end of the day, you can also earn to make your life better, right? Yeah. So there's no pressure. You purchase at your own time. You can build a business on this platform. You can earn on a weekly level, on a monthly level from this platform. It's all determined by your performance. Now, you can earn in different ways. You can earn through retail profits by selling the products. You can earn through selling our fast start bonus package and enjoying the fixed amount that's accredited to it. You can enjoy performance bonus, development bonus, leadership bonus, car incentives, house incentive, educational scholarships, and a whole lot of other benefits. With Longrich, you can grow. You can become as big as you want. Now, the goal of every Longricher is to become a star director, right? A 5-star director. So keep growing, keep building, keep doing what you need to do to grow. And don't forget that nobody determines your success on this platform. Your growth, your progression is determined by your capacity to produce results. So with Longrich, it's about a better life and a better future. So switch your brand. If you're first time on this call, switch your brand, switch to Longrich organic products. You've seen what I've said. You can't take green tea and end up with UTI because you see, your body already has what it takes to maintain the kidneys, and UTIs cannot, stay in your body system. Be a product user, share your testimonies. What I've shared with you now, share with other people so they don't suffer, the issues of having urinary tract infections, and enjoy, a better life and a better future. So my name is Dr. Sadiq Kugene. I want to thank you for spending this time with us. And I want to leave you with this saying I would always leave you with. Good health is the most important thing. People, is more important than success, more than money, more than power. Power cannot give you good health. Success cannot give you good health. Sometimes money cannot give you good health. Only good health can keep you alive for a long time. Thank you very much. And thank you for making a date with me. Until I see you again next week.